Going to discuss a really hard topic that is very confusing to some nursing students. We're going to talk about the posterior pituitary hormone, ADH, that is secreted to help maintain the serum osmolarity in your body and also maintain your water balance. And so we're going to discuss SIADH and DI and the things that you need to know for your nursing tests. Let's go through the two types, SIADH and DI. Now, first, you have to know that sudden inappropriate antidiuretic hormone means you have too much ADH. That means you hold on to water, you are soaked inside. The S for the soaked inside is the S in the SIADH, to help you remember that. Now, in the bloodstream, if you have too much fluid, what happens is you become diluted. Your blood becomes diluted with so much fluid, and you get what's called dilutional hyponatremia, so decrease of sodium. Your sodium levels are going to be less than 135, and this is important to know because when you have a low sodium level, your signs and symptoms are going to reflect that. You're going to have a headache, nausea, vomiting, and you're at risk for having seizures. Because you're water intoxicated, again, you're in a fluid volume overload, you're going to see an increased weight gain. And because you have so much fluid in there, your heart rate is going to be down, but your blood pressure is going to be up because you have such an increase of that intervascular volume here. Now, on the opposite side of your urine, what you're going to find with SIADH is you're going to have a low urine output. You're going to, when you have a low urine output, you're very concentrated with a lot of particles here. That's why you're going to have a high specific gravity. So greater than 1.030 is going to be your specific gravity, and you're going to see that in your urine here. It's going to be very concentrated. Now in DI, it's going to be the opposite. So you're going to have a decrease in the ADH of the antidiuretic hormone. So instead of holding on to water, you're going to be dehydrated. You're going to be excreting a lot of water. And how you do that is through your urine. And you're going to have a very, very large amount of urine output. Up to sometimes 20 liters a day. That's very excessive, but you're going to see a very increase. If your patient all of a sudden starts to have a lot of urine output, you need to think DI. Well, what happens when you're dry inside, the D equals dry inside or dehydrated, in your blood levels, you become fluid volume deficit. So the sodium builds up because you're dehydrated. So you're going to see an increase of your sodium levels to 145 milligrams per deciliter. And when you become fluid volume deficit, you become very dehydrated. So you're going to be thirsty a lot and have dry mucous membranes and probably have a small decreased skin turgor problem with some of the things that you're going to see. With the intervascular volume being down, your blood pressure will be down, but your heart rate is going to try to compensate that by increasing. Now, opposite with the specific gravity is D for down, is that your specific gravity is going to be down. You're going to have a lower specific gravity. So D for down is going to be, your specific gravity is going to be less than 1.005. I go through more treatments and the medications to give for these two disease processes in my nursing notebook.